Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. In this video, let's take a look at how you can heal mononucleosis with natural and effective therapeutic tools. Mono is called the kissing disease because it's spread by contact with bodily fluids, especially the saliva. The mono symptoms are most commonly seen among teens and young adults, especially with this extreme fatigue, which can go on for weeks and even months. So in this presentation, I will share with you informative and educational material how to meet this situation more holistically. So enjoy this video. To stay updated with more ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and likes. So let's go on. What is mononucleosis? Well, mononucleosis is a viral infection that causes this extreme fatigue, maybe high fever, and this typical swollen lymph glands along the neck or under the armpits. Mono symptoms usually appear 4 to 6 weeks after the infection, and the incubation period can be a little bit shorter with young children. So what are the common symptoms? Well, this extreme fatigue, debilitating fatigue. It can even lead to chronic fatigue syndrome. You maybe experience a sore throat, high fever, often this throbbing headache with it, body aches like, when you have a flu and your muscles are all aching. Definitely swollen lymph glands along the neck and under the armpits, swollen tonsils even, there can be some pus formation involved. Some experience a rash all over the body, and the two organs which are mostly affected is the liver and the spleen. So the spleen often enlarges during mono, and therefore we want to bring in good natural products and supplements which help to sort of really heal the liver and the spleen during this infectious period. So the 3 typical mono symptoms are the sore throat, the high fever, and this enlarged lymph glands along the neck and under the armpit. However, the more unique clinical feature of mono, which helps doctors also to distinguish it from other viral or bacterial infections, is this debilitating fatigue, which accompanies these symptoms and can even last for months after the actual acute mono has been resolved. So most people have this uncomplicated mono that goes away, within a few weeks. However, others develop complications, and that includes extreme swollen tonsils that can even block breathing, or chronic fatigue syndrome, myocarditis, which is inflammation of the heart muscle, anemia, where we have a decreased platelet count, then liver inflammation, you maybe see hepatitis here, or meningitis, where the protective membrane that covers the brain and the spinal cord are affected. Barr syndrome, which is an autoimmune disease that affects the peripheral nervous system. All that can be related to mononucleosis. So what are the causes and the risk factors? Well, I mentioned it's a viral infection. So the virus which is here affected is called Epstein-Barr virus, or EBV. And it's the most common cause of infectious mono symptoms, but there may be other viruses also involved. Now, Epstein-Barr virus, also known as the human herpes virus 4, is one of 8 viruses in the herpes family, and it's one of the most common viruses in humans. The virus occurs all over the world, and researchers say that 90% of the entire world population has been exposed to Epstein-Barr virus at some point in their lives. So we all have it, right? I have it too. I had mono in my early 20s. And so, as I said, most are not even aware that they have this recognizable illness. And particularly in children, even you don't even see the actual chronic fatigue expression here, and often they can resemble symptoms of just mild or brief childhood illnesses. But in 50% of adolescents, Epstein-Barr virus infection causes therefore infectious mononucleosis. Infectious means it can be passed on and it's contagious. So mono is most commonly present in patients between the ages of 5 to 25, but I think the main group here is between 16 years to 20 years old, I think. Why? Hey, because we hang around and we kiss and we touch and, we have contact. It's also suggested that sexual intercourse, could be part of the transmission. Now, how pre-adolescent children get Epstein-Barr virus, it's called the kissing disease. It's not really known, but they assume it's because siblings or parents are handling the children and giving them a, peck on their cheek. It can be sort of an oral transmission happening. But the virus which causes mono is really typically spreads via bodily fluids, and that is the saliva. But it can be also through blood or the semen, like sexual contact, blood transfusion, and even sort of organ transplantation can be part of that as well. So on exposure to the Epstein-Barr virus, sort of the virus in itself multiplies in the epithelial cells of your pharynx, which is here, the upper part of your throat. And after that, it multiplies, we call it the B lymphocytes, it's a type of white blood cells. And following this, we have then these abnormal and enlarged lymphocytes, which develop when we call it the CD8 positive T cells respond to the infection. So after the primary infection, the Epstein-Barr virus remains in the B lymphocytes for a lifetime. So you never get rid of the Epstein-Barr virus. And although it causes maybe not any symptoms, there are times in your life when you can reactivate it. I want to talk about this. Most adults, as I said, have been exposed to Epstein-Barr virus, and they build up usually antibodies and become immune therefore. So you won't get mono again. Although mono symptoms go away, the infected person will always carry the virus, right, that caused it. So once the virus is in your body, it stays, we call it, in an inactive state. It doesn't do much. But it may become active again without causing any symptoms as well, or symptoms. And when this happens, when you're in the active state, you can therefore pass on the virus. You're a carrier of the virus, and that's really important, and you have to realize that. So what are the situations which can reactivate it? And I would say long-term stress really is on the top of the list here. In fact, they made a study where they found a significant difference between the rates of Epstein-Barr virus infection and the reactivation among participants who had elevated, and it's called epinephrine and cortisol level. That means your adrenals are affected. Adrenals are the glands which sit on top of our kidneys, and it's all about fight and flight, right? Survival, anxiety, worry, right? Not being able to sleep. There's something as if a lion is running behind you every single day, this kind of experience. And they suggest that increased stress hormones can cause the dormant virus to come back again. So if you know you have active mono, it's very important that you don't have contact with people. Avoid kissing anybody or sharing things like drinking glasses, maybe drinking straws, utensils, toothbrushes, lip balm, and so on. I also want to point out that there is a strong connection, and we do know that now today via scientific research, that Epstein-Barr virus is related to other health conditions, especially if you are diagnosed with thyroid disease and Hashimoto, lupus, multiple sclerosis, as well as certain cancers like lymphoma, Hodgkin disease. Certain cancers, maybe gastric cancer or nasopharyngeal cancer. There's a direct link here. So it's, often people just focus on the thyroid, maybe in Hashimoto, or maybe on the digestive system as well, because there's a link between the digestive system and our immune system. But Epstein-Barr virus is really the underlying cause here often, so please don't forget that. I personally had a really long-term experience with mono. I had, as I said, mono in my early 20s. And I was a young mother, was a single mother with 2 kids. Life was very stressful. I was juggling many things at the same time, completely burnt myself out. And did I get it through kissing? I don't know, honestly, but I got mono. And therefore, it never really left my body, as I shared with you before. And I also can verify that the swollen lymph glands on my neck only come about if I am exposed to strong stress today, right? That's exactly when I know my Epstein-Barr is active. So how can you test that you have Epstein-Barr virus? Well, there are some tests on the market. One is called the mono test or the mono spot test. But the Center of Disease Control doesn't really recommend the mono spot test by itself because it can give you this false positive or false negative result. It's so therefore not specific for the Epstein-Barr virus. We want to go for blood tests that deal with the antibodies of the Epstein-Barr virus, and these include tests like viral capsid antigen, early antigen, and Epstein-Barr nuclear antigen tests. So people who do not have the antibodies to this viral capsid antigen are susceptible to the infection. And the presence of the antibodies of this we call it VCA or viral capsid antigen, IgM, to viral capsid antigen and no antibody to the Epstein-Barr nuclear antigen points to a new or recent infection. But if you have antibodies to both the VCA and the EBV, the Epstein-Barr virus nuclear antigen, then it means it represents you have a past infection. So if your blood test shows that you have antigens to both of these situations, it means you had it in the past. But if you don't have the antigens for the Epstein-Barr virus, it means you had a new or a recent infection. And that's the way to figure it out. So what is the conventional treatment? Well, there is actually no treatment. And that's really the scary part because it's a viral infection. So your doctor mostly gives you corticosteroids or over-the-counter pain medications. Of course, they come with a truckload of side effects. And therefore, I want to make this video and share with you that there are natural, effective, and more holistic treatment protocols available for you. So if you're interested in a health consultation, either for yourself or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. So book your appointment today. So let's move on to our second part, the food for thought, the metaphysical meaning. As with all of my videos, I always want to guide you to within. Look around your life, your work environment, your relationships, your marriage, relationship towards your children. Say anything which stresses you out. Are you stressed? Are you worried about your finances? Have you lost your job? Particular now during this pandemic, there's not one of us who is not affected by worries or even anxiety. Now, as mentioned before, especially stress can really reactivate the Epstein-Barr virus within your body. So let's take a look at this a little bit and see if you maybe can resonate with the story which I'm going to share with you. I always refer to Chuck Martell's references because he really researched the metaphysical meaning with today's common illnesses. He says infectious mononucleosis is an infection characterized by an increase in the lymphocytes that are part of the blood's leukocytes or the white globulus. And by now we have established that. And then he goes on, he said, if I'm an adult and I have this disease, I try to find out what may have affected me, as if I was an adolescent, or what it reminds me of from the time of my adolescence. Well, if you remember, right, we burned the candles on both ends. We were really adamant about our opinion. We were very definite. Right? We had certain ideals. Some of them came to fruition, some of them not. I want to live fully. I sense a change in me, and I feel that I have to constantly fight to obtain what I want. My system of defense has evolved to compensate for the attacks and limitations that I had the impression of receiving from life. I feel I'm alone to face the obstacles that come up before me, far from the clan. I want so much to feel accepted by my family, my friends, and society. And around this time, you push your family away often, right? You want to sort of spread out and spread your wings, but really deep down, you still need them. Just like a wolf, I want to be part of the pack, but I feel so alone, like a scrap of waste in society. I disparage myself and I get to the point of wanting to push other people away, but at the same time, I need to hang on to them. This brings about an inner duality and great tension. I develop mononucleosis when I feel guilty over a situation or when I want more permission, when I criticize people or life in general. I have a deep love sickness. Mononucleosis has a link with the problems involving the spleen, for the organ that increases in volume. You know, the spleen as an organ has a lot to do with doubts and worry in itself, and the liver is the organ which often is affected by anger, frustration, even rage. So it makes perfect sense that teens and young adults, who experience this heightened emotion are maybe susceptible to mononucleosis. So what would be the positive affirmation? I accept to clean up my life and to put more love in it for myself and for others. I get back my courage and my self-confidence, and I can then recover my energy and my joy in living, which will enable me to experience more love. It always goes back to loving yourself, in particular with the mind-body connection. So explore that, embrace yourself, and give yourself a big hug. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths, qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I'm coaching you to be well. Let's talk about natural treatments. There are great herbal extracts on the market and homeopathic remedies which help you heal your mononucleosis. The first one is called Astragalus Root. It's a herb which is often used in traditional Chinese medicine, great immune booster, and it has antiviral, antimicrobial, and anti-inflammatory capabilities. With it, I want to combine it with Echinacea. It doesn't matter if it's Purpureum or Echinacea perfoliatum. Usually buy a good product in your health food store. Again, has antiviral effects, but also when consumed, it can stop recurring infections, and that's really what we want here. As soon as the lymphatic system or the blood is involved, I always think about garlic either in raw form on a daily basis, and if you don't want to have that smell, you can buy garlic capsules. and take them on a daily basis for a few weeks. It really helps to clean your lymph and your blood. Now with mononucleosis, we want to bring in good strong armors, right? The best of the natural toolbox here. And here I'm thinking about olive leaf. It has the ability to treat dangerous viruses by destroying invading organisms and stopping the virus from replicating and causing an infection. The same like Echinacea. So that would be a good suggestion here as well. Of course, we want to have a strong sort of focus on our healthy diet here, because your immune system is really related to what's on your plate. So we're going to start with probiotics in the morning, because they help to support your immune system as well as create a healthy microflora within your entire immune function. With it, I would say bring in more immune boosting, healthy sort of anti-inflammatory foods. We talk about omega-3 foods, including green leafy vegetables, beets, blueberries, bone broth, wild salmon, walnuts, as well as magnesium and potassium-rich foods, because it helps you to overcome the fatigue, improve your energy levels, but also support your healthy nerve function, which is all affected with mononucleosis. When you feel moody and you feel tired all the time, you maybe want to bring in some vitamin B complex. It really boosts your energy, and it just boosts your cognitive function too, because when you're exhausted and tired, you can't concentrate. It's like you don't have any motivation anymore. So vitamin B complex would be a good suggestion here as well. And of course, if you are in the acute state of mononucleosis, get plenty of rest, get hydrated, drink a lot of water. And if you know you have acute symptoms, of course, you avoid contact sport, right? You don't want to be the carrier or the one who passes on the Epstein-Barr virus more. So, don't share the toothbrushes, for a while. I want to pass or finish this video with homeopathic remedies, because that's really my sort of toolbox, which sort of like completes the whole ultimate healing protocol with mononucleosis. We have already established now that we know that Epstein-Barr virus is involved, and it's counted among the members of the herpes virus family that are known to cause the infection in human beings, especially with infectious mononucleosis. But homeopathic remedies not only boost the immunity of the body to fight with the infection, but also they manage the individual symptoms of mono, and that can be the feeling of tiredness, the sore throat, the swollen tonsils, the swollen lymph glands along the neck and under the armpits, the headache, the skin rash, the muscle pain, and so on. And there is no one remedy that fits everybody, right? It's not just a magic pill. Here you want to individualize the medicine protocol, and that's the beauty of homeopathic remedies, because it really, when you know how to use it, you can really help the very core of your beingness, and not just has sort of an overall one fits for all remedy. But this condition requires more professional help, and therefore in this video I want to refrain a little bit from the dosage plan, which I usually suggest, and rather encourage you to contact my practice Medica Nova at health@medicanova.net to book your appointment, or contact your local healthcare practitioner and professional homeopath for that, because it's a little bit too, let's say, intense, and we don't want to do just home remedies over the counter here. But in this video I want to give you some options, right? You do have options, and you have also access to natural solutions without consulting a doctor. So I want to just empower you a little bit here. In a minute, I share with you homeopathic remedies, and with that, I also suggest maybe to purchase online the homeopathic liquid. It's called Epstein Barr virus 500C. It comes from the Professional Formulas company. You can take them along the suggested homeopathic remedies now, and that would be a great aid here as well. So let's talk about acute and chronic symptoms. Well, if you have mononucleosis, where you are so tired, right? That's the first symptom which comes to mind, to the point that any slightest exertion makes you just go to bed, want to go to bed. That's Arsenicum album. Arsenicum album 30. You can get that in your health food store. It's an over-the-counter homeopathic remedy. There's a tiredness which is felt by just even slightest moving around. The tired feeling compels the person to lie down. Often it's worse by the end of the day, nighttime. There can be also accompanied a great restlessness and anxiety and worry about it, but you feel totally exhausted. On the other hand, if you're not just tired, but you're mentally weak as well, that means you don't want to do anything. You don't even want to read a book. It just exhausts you mentally as well as on the physical fear. You're tired, exhausted. Then the remedy Kali Phosphoricum is a great remedy here. Now there are two forms. One is the traditional homeopathic remedies, Kali Phosphoricum 30. But you also get it in the called homeopathic biochemic cell salt, or in Europe they're called tissue salts. And it's called Kaliphos. And here I would say 4 tablets morning and evening. Do it for 2 or 3 months even. It's a pick-me-up remedy. It's a great remedy for nervous exhaustion. If you choose the biochemic tissue or cell salt form, then I would say 4 tablets morning and evening. With the 30 potency, I would say morning and evening, really. Try it out for a month, plus, the other remedies. It really helps you to just regain your strength again. Now, if your mono symptoms is very much or focuses around weakness, dullness and drowsiness, to the point where you have this pain and the soreness in the muscles. Sometimes there can be a dull headache with it. The pain is mostly felt in the back of the neck. We call it the occiput. There can be a sensation of a band around the head. It's also felt. And there's this feeling of a droopiness, or the eyelids are very heavy and you just want to go to bed. Gelsemium 30 would be the remedy. That's a fantastic remedy. Gelsemium sempervirens is actually the traditional sort of Latin name. The next remedy is called Carcinosin. It's either in the form of potency 30 or 200. This is really a remedy which I always give for chronic fatigue caused by mononucleosis, where the person really feels like I never was well since the glandular fever, since the mononucleosis. It's a great remedy indicated for recent and long-standing cases for mononucleosis, but here you need a professional homeopath. They don't prescribe that by itself. I want to just quickly sort of scratch on the acute symptoms as well a little bit. If you happen to be in the acute phase and have a sore throat or tonsillitis, where your throat is very red, the tonsils are swollen, enlarged, inflamed, of course painful to swallow anything, the throat feels very dry, there may be a sensation of a lump in there, Belladonna 30 would be the remedy. Fantastic here. It's also greatly indicated if you have this throbbing headache, particularly in the temporal side of your head. It's really, the headache feels very congested here, and there's this heating sensation, high fever, Belladonna would be the remedy. On the other hand, if you already have a sore throat where we see a little pus points involved, particularly when you have this pain which is sort of stitching, as soon as you swallow it stitches to the ear while eating food, or even swallowing food is almost impossible. Think about Hepar sulph 30. It's a great remedy here. It's almost a feeling of a plug of mucus in the throat is here felt as well. You maybe even hawk up thick yellow mucus from the throat. Hepar sulph is wonderful. It can even go into a situation where you have a sore throat and now we have the inflamed tonsils, where we see true pus, ulcers maybe. There's a soreness, there's a burning or smarting sensation in the throat. Of course, swallowing is almost difficult. The pharynx may be bluish red. Usually we can see the presence of ulcers. Along there's increased saliva, and you maybe even feel like your breath smells really badly by then. Mercurius solubilis, again a remedy available in your health food store. 30 would be a great choice here. We have other remedies like phytolacca when you feel like you have a sore throat or tonsillitis with this marked burning pains. I talked about the lymph swelling along the neck and under the armpits. Here we have remedies like Calcarea, Carbonicum, Conium, Mercurius solubilis, and phytolacca. But I said this is a little bit the scope over your professional or your home skills. So it's best to contact your healthcare practitioner. Mono can also affect your muscles, right, or your joints, and if you feel like that's really the keynote in your experience, or your joints are affected since the mono, there's a remedy called Rhus toxicodendron 30. You can get it in your health food store. It's the top listed remedy here to manage muscle pain. There's a soreness, your joints maybe can be affected, and the keynote here is that the first movement, maybe getting up from a chair, is really painful and it causes you this stiffness, and continued movement, like once you get going, it sort of eases up a little bit. It's also a great remedy for arthritis, of course. And then mono comes also sometimes with a skin rash, and here it can be very itchy. The itching usually gets worse towards the end of the day, or the warmth of the bed or after a hot shower can aggravate the itching. The remedy would be sulphur 30. Again, available in your health food store, and it will take away this burning sensation and the itchiness. So I hope this video, again packed with great information and educational material, has given you some guidelines that there are natural solutions even for mononucleosis. If you're not quite sure how to take these remedies or how to apply it to your own individual case, contact my practice Medica Nova at my website medicanova.net or via my email health@medicanova.net. I'm happy to help. Book you in for a consultation and we take it from there. If you ever wanted to expand your knowledge about integrated medicine, then I encourage you to go onto my website medicanova.net at the online academy, where you will find university standard certified home study online courses in homeopathy for the whole family, or homeopathy applied during pregnancy, birth and postnatal care. If you ever wanted to learn more about integrated mental health, we talk about depression, anxiety, Alzheimer's, dementia, or you really wanted to know about health and wellness coaching and educate yourself, or about quantum healing, this is the place to go. Next to being a healthcare practitioner, I'm also a university professor at the University of New Mexico, where I teach university standard courses for about 18 years in integrated medicine. So I'm a seasoned teacher, I love it, and I would like to share that information with you as well. So till next time, much love, take care.